Hello, I'm Will Gray, and welcome to Walk the Valley, the podcast that breaks down the barriers to bringing healthcare innovations to market. In today's episode, we're joined by Paula Petcu, co-founder and CTO of Interhuman AI, a Danish startup that combines research and artificial intelligence to create empathetic and context-aware interactions between AI and patients. Paula walks us through their approach to the market, so let's dive right in and take a walk in the valley. Very briefly, where are you as a company? What kind of stage are you at?
We are quite early stage. We have developed a solution and tested with users. So we have a working prototype for an AI coach that people can talk to and provides adaptive conversations based on what people say and how they're saying it. So it's technology that comes from the Danish Technical University here in Denmark. And we are going to release a solution for the public within the next months.
Okay.
And yeah, it's still early, but we're planning for some pilots as well and releasing soon. You were talking about healthcare, and the first application that we do not have any claims on the healthcare system. It's a solution to provide people a way of better understanding themselves and other people.
Yes.
And in addition to the commercial side of it, of launching this product, we also have a research roadmap. And on that one, we're working more on mental health.
Okay, interesting. So that was an interesting point you raised there, is that you don't have any claims, therefore you are kind of outside of regulatory requirements in that respect. Is that correct?
The healthcare regulatory requirements, because we are using AI and we are operating in Europe. So we comply with GDPR and the ISO security standards, and then following the EU AI Act. Of course, it's like quite new. A lot of things can still change, but we're following to see like where are we, like what do we need to document and so on. And I also had an interaction with notified body, which you usually interact with for medical devices, to kind of evaluate what we're doing, what we can say, what could be the plan, the roadmap, and so on. So we've already done a bit of that work. So we know we're planning ahead for the next years.
So the notified body is for complying to the EU AI Act, is that correct?
They usually help people in terms of complying with medical device regulations and so on. But in this case, they're also interested in helping the startups that will have to go through that, also on AI. And complying with the EU AI Act. So they've taken under their umbrella that they help with that, knowing that there will be a lot of startups, a lot of manufacturers of medical devices or software as a medical device that will use AI in their product, and thus they're trying to stay ahead and staying on top of things. So that's why I took contact with them to see where we are.
Interesting. Would you be able to say very briefly like a pro and a con of the EU AI Health Act, where it's from your own perspective, like one immediately kind of benefit of it and one potential kind of maybe it's a hindrance or a con?
Yeah, I think it's a very good idea because it ensures what the entire idea of the EU AI Act is to ensure safety for people, and that the implementations of AI are done correctly, that we don't have biases that will kind of make some people in the society be ignored, or we discriminate more than we do today. So it's very important that we have some kind of regulation to keep things safe. We don't end up in like one of these Black Mirror episodes, right?
Exactly, yeah.
The con is that it imposes a lot of effort on smaller startups. It's a lot of documentation, a lot of requirements. And when a company is being built, especially one that wants to disrupt kind of the industry and grow and move fast, this is kind of a blocker. And it's a bit unfortunate. I think for us, we have a better view of the impact because in our team, including myself, we have previous experience from pharma and software as a medical device. So our team is used to regulations for patient safety and so on, and also working with all these systems, good clinical practice, and software as a medical device regulation and so on. So we also have an understanding of the effort needed and how to approach these things, which the way that we do it is risk-based approach. We evaluate, we document what is the potential risk and mitigate those with different actions, but it's also risk-based, as in there are certain things we can live with that we do not do now because the impact is not, the risk is not that high, and then we can do it later because we are a small company, so we need to move fast. So, but it will be really costly for a lot of companies to do this, and it kind of provides an advantage more to larger companies that already have like a huge legal team and regulatory team. So for them, it will be like, yeah, we need to do this, and already somebody can do it. Smaller teams, it will make a huge impact on the budgets and effort needed.
It's always the criticism of kind of new regulatory changes is that it's the hardest hit is on the smaller companies, right?
Yes.
Yeah. Absolutely.
Yeah.
I'm always interested in this kind of idea of decentralized healthcare. I think it's something that's really very much in this kind of very fluid state and changing and coming out, and all of these products that kind of put more power in the hand of what you might call the patient or the user or whatever it is. Would you see yourselves as a company that's kind of very much on the forefront of that as well?
Yes, absolutely. With looking at digitalization, and some of the things that we are exploring is collaborating with therapists and psychologists with their existing clients, which are patients that either have stress, anxiety, or even depression. And we provide a solution that is kind of an add-on that patients can use remotely. So in between therapy sessions, people can go home and take their phone and discuss about their challenges in their daily life in a way that they wouldn't be able to do with their therapist. The therapist has limited time. It's also expensive if you're paying for it. So this provides a more accessible way to actually be supported in real time, like whenever you need it, wherever you are. And so that's one of the things that we're doing through this. And we are yet to run some pilots on that, but also the way that our solution is built, it's built together with the psychologists and therapists. So hopefully it will support that journey, and we'll have some data soon.
What would be your kind of off the top of your head opinion about this kind of very rapid change in digitalization and healthcare and implementation of artificial intelligence? It's moving like very quickly. What's your kind of thought on? Obviously, you've got the regulation that is trying or attempting at the same time to limit it in some way or control it, but where's this all going?
I think it's interesting to follow, and when we say AI, it can be different things, and I think it got kind of a bit of a different meaning depending like your background, because now everyone, when these days when people say AI, they start thinking more of generative AI, large language models like ChatGPT. That's what they've been exposed to recently, and so their thought is that like communication and like optimization of processes, and that's great. A lot of opportunities there, and I think especially on the administrative side. So drafting better communication with patients, like if you have difficult patients, or you need to express in a more diplomatic something, or make it very clear on what step by step the process is for when patients are home, or something like that. That's, I think, a great potential that doesn't have so many regulatory implications because you do not share any personal data. The challenge is if you use it in actual diagnostic or remote monitoring or any kind of thing that includes personal information, disclosing something about the person's diagnosis or health condition. And there it's unclear. And I think we are saying that AI is moving fast, but the implementation in healthcare systems, it's not fast.
No.
So it's kind of a mismatch, and I think it's unclear how this generative AI will actually impact the healthcare system, where you need to share personal information, and whether it can be actually implemented in the public healthcare system like we have in Denmark, or it will be an add-on that patients need to opt in themselves and pay for, because it's not something provided through the public healthcare, because that's a huge integration challenge. And I think also for us, it will take some time to discover. But that's not to say that there aren't many great AI applications already in healthcare, because AI goes beyond what we've heard recently about ChatGPT and large language models. It's all the machine learning, modeling based on data in radiography, in medical image analysis, in prediction based on voice biomarkers. All of these things, some of them are actually implemented in the system, right? So that's amazing to see. There is something there we can piggyback on, but still unclear with the new AI technologies.
Very interesting. What's your advice? You're going through this stage now, but what's your advice for kind of early stage companies who are approaching the market with technologies that are disruptive like yours? What would be your one kind of like key takeaway or key advice for them?
I think like it's a given that they should not do it alone, but in partnership with the domain experts, whether it's therapists, psychologists, MDs, and also together with the patients that they will help. So I think that's a given. I don't think there's any way around that in order to make a successful product. Do get familiar with like the regulations and network, talk with other founders that have been into the journey and learn from them. There are great networks that people can tap into. I'm organizing one of them with digital health meetups here in Copenhagen. Every month we have a meetup on different topics within digital health, and that covers both digital solutions, integration solutions, wearable sensors, apps, and medical devices. So it covers different aspects, and there are similar networks that are available. That I think it's important. I think it's compared to, for example, other industries where there's more competition and secrecy. I think in digital health, it's easier to share your experience and learn from each other. People are more open and friendly to and more willing to share their learnings, both good experiences and bad experiences. And I think that's super, super valuable.
That concludes today's walk through the valley. We hope you got inspired by Paula's journey and insights. Be sure to subscribe for more stories about the tough but rewarding journey through healthcare innovation. If you enjoyed the episode, leave us a review. That makes a big difference. Thanks for joining us, and until next time, keep walking the valley.